Diabetes. Diabetes is a disease that occurs when a person's body cannot control blood sugar levels on its own. This is because the body does not produce or cannot use insulin, the hormone that controls glucose.
There are two main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow-healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the and there's much less risk that someone will experience these complications. If you've got diabetes, you can find lots of information and support about living with it using our website and helpline. As well as campaigning for everyone with diabetes to get the right care, Diabetes UK fund research into all types of diabetes so we can develop new treatments.
It has different types. Type 1, in which the destruction of beta cells prevents the pancreas from producing insulin. Type 2, in which the patient's body cannot use insulin effectively. And the newly discovered type 3C, which occurs as a result of disease affecting the pancreas.
Referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions, type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Prediabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent.
Insulin on the basis of real-time sensor glucose levels. Some investigations have shown improved glucose control and a reduced risk of hypoglycemia. About type 1 diabetes and beta cell.
Type 1 diabetes is an autoimmune disease. If you have type 1 diabetes, your immune system has destroyed the cells of your pancreas that produce a hormone called insulin. Your pancreas is an organ located in your abdomen. Among its functions, it produces different types of hormones. One of these is insulin. Insulin is produced in patches of tissue called islets of Langerhans. The majority of islet cells are beta cells, which normally produce, store, and release small granules of insulin into your bloodstream. Insulin attaches to receptors on cells throughout your body. This allows glucose, a form of sugar produced by breakdown of foods, to enter the cells to be used for fuel. In type 1 diabetes, the immune system mistakenly destroys the beta cells that produce insulin. This means glucose cannot move out of the bloodstream into cells to be used for fuel.
The artificial beta cell uses a control algorithm to independently monitor and increase or decrease insulin delivery based on real-time sensoring of glucose levels. In contrast, insulin pumps that link insulin delivery to sensors that continuously monitor glucose levels can only temporarily suspend insulin delivery based on preset glucose thresholds. These systems can decrease the risk of hypoglycemia but cannot respond to hyperglycemia. More consistent glucose values were observed with the closed-loop system than with the control therapy, despite high day-to-day variability in insulin required.
Because injections can send the destruction of transplanted cells. Artificial beta cells are a better alternative to diabetic treatment. A new possible treatment for diabetes uses artificial beta cells, which replace the function of regular beta cells. Beta cells are found in the pancreas and produce, store, and release the hormone insulin. The artificial beta cells are filled with insulin and have a membrane that lets insulin out when an increase in blood sugar is detected. This gives a very exact and autonomous treatment for high blood sugar. We know that artificial beta cells work. The problem is that the use of artificial beta cells hasn't become a viable treatment yet for in-home use. Doctors can inject it every few days, but people can't administer it to themselves. The cells could be injected into the patient or through a disposable patch, which would be replaced every few days. However, they haven't made a patch capable of delivering the artificial beta cells, as things delivered using the patch need to be a certain size to work, meaning the cells need to be small enough to go through the skin.
Type 2 diabetes is characterized by declining beta cell function in the presence of rising blood glucose levels and relatively constant insulin resistance. In response to insulin resistance, normal healthy beta cells will compensate with increased insulin production, and the patient will remain euglycemic. In contrast, susceptible beta cells cannot compensate, failing over time to produce enough insulin to meet demands, and eventually leading to prediabetes and the vicious cycle of hyperglycemia. Although the process of beta cell decline is not fully understood, mounting research suggests that genetic mutation may underlie beta cell susceptibility. Underlying susceptibility in a subset of the population may help explain why only approximately 1/3 of obese people go on to develop diabetes. Only people with susceptible beta cells are unable to compensate for stressors that normal beta cells are able to withstand. Recent studies suggest that the process of beta cell dysfunction begins early in the natural history of the disease. As insulin resistance persists, beta cell function decreases up to a compensatory threshold that represents the beginning of symptomatic diabetes. After this point, beta cell dysfunction accelerates rapidly, and insulin secretory capacity may be permanently lost. Checking glucose values is the best way to determine if beta cell decline is beginning, especially for patients who may not yet display overt signs of diabetes but may have a family history of type 2 diabetes or other risk factors. Rising glucose values are a sign that beta cells are no longer able to supply enough insulin to meet the body's demands. In the early stages of beta cell dysfunction, the disease process is potentially reversible. If patients are treated early and aggressively with a combination of diet, exercise, and/or medications that promote a more normal relationship between beta cell function and peripheral insulin sensitivity, we may be able to delay, prevent, and even reverse the illness. Studies increasingly suggest that addressing beta cell dysfunction before insulin secretory capacity is permanently lost may promote safer, more effective care for this vulnerable population.
The advantage of a closed-loop system is the responsive gradient modulation of insulin delivery path, low and above the presence pump regimen, which allows for improvements in the proportion of time spent in target glucose range and lowering of the mean glucose level without increasing the risk of hypoglycemia. It will be very useful for patients while they sleep or play sports and proves useful for home use. Cons: 3 severe episodes of hypoglycemia happened with the artificial beta cell, all when the system was not in use because of low battery or the system was not turned on. Artificial beta cell technology is still fairly new and the feasibility, safety, and efficacy of its prolonged use in the home setting have not been well established. Diabetes is an increasingly common disease in Ecuador. There are 2 types, 1 and 2. Type A1 affects more children and young people. It is linked to a genetic factor that develops at an early age, and type 2 is the most common in the country and affects mostly adults. Of 100 diabetics in Ecuador, 2% are type 1 and type 2 is 98%. The type 1 is prediabetes, which is reversible and controllable but if not detected and treated in time because irreversibility. Diabetes if the blood glucose exceeds 126 is confirmed diabetes, which is treated with oral medication and insulin. The most used in the treatment of type 1 diabetes is insulin. The insulin pumps are also used in our country but in a lower percentage because their implementation and maintenance is economically high. This insulin is given to the patients before every big meal to not result in high sugar levels. The minimum must use test strips 3 times to know the level of glucose patient's blood. Conclusion 3. There are several advantages of a closed-loop system due to its responsive gradient modulation of insulin delivery both below and above the present pump regimen. They report that this allows for improvements in the proportion of time spent in target glucose range and the lowering of the mean glucose level without increasing the risk for hypoglycemia.